Good morning, everybody. Welcome to the ARTARx delivery policy update. Yatin Patel, our Director of Pharmacy, will be giving you updates on the delivery policy. I just wanted to touch on a couple housekeeping notes. This session is being recorded and we will be posting it to our YouTube channel. So if you have any questions throughout the presentation, please use the Q&A function in Zoom. And we have some ARTA staff available that will be answering those questions as we come in. And then we'll also allow some time at the end for Yatin to answer some of those questions live. So with that, I will pass it over to Yatin Patel, our Director of Pharmacy.
Thanks so much, Jennifer, and thank you all to those attending this session. I'm hopeful to address a lot of the questions and concerns that have come up since we've notified our members of this policy change. I'm going to go through a few slides here that will hopefully answer the majority of the questions that we are experiencing in the pharmacy, also provide some context around what and why this is happening. So I'll just dive into the presentation here. So just to outline the broad spectrum topics that we'll be discussing here. So an overview of the pharmacy, its licensing model, the college, the Alberta College of Pharmacy as our regulatory group, the standards of care for virtual, or standards of practice of virtual care, which is the standard of care or the standard of practice that is impacting delivery and how it's conducted by ARTARx. We'll get into definitions about in-person care and delivery services, and then we'll go through how eligibility for delivery services is determined and what are our options for our clients. Again, we're hopeful to leave a lot of time to discuss the questions and concerns of our members afterwards as well. So just taking a brief step into the background context of ARTARx Pharmacy. So we started this process in 2023 when we were approved for a pharmacy license. What was approved by the Alberta College of Pharmacy for our license type was a community pharmacy. There are several different pharmacy licenses that are available in Alberta. Community pharmacy, mail order pharmacy, and compounding or repackaging pharmacy. What was approved as a community pharmacy. So what that means is like your standard conventional community pharmacy, all the privileges and responsibilities for that pharmacy are applicable to us. The other model type that we were not going to be approved by the college is a mail order license. And I'll just touch on what a mail order license is. It's the provision of pharmacy services where clients are not directly attending the pharmacy. So what this license type generally supports is specialty pharmacies that are maybe dispensing biological drugs or supporting long-term care facilities where clients are provided their medications in a facility where they're overseen by nursing and physician and pharmacy staff on site. So those are the general models for mail order pharmacies, which ARTARx is not. We are a community-based pharmacy. Okay. And like a community-based pharmacy, we provide those services that are related to communities. So dispensing, counseling, we do travel consultation, immunization health, care plans, those typical things that you would get from a neighborhood pharmacy. So ARTARx's model and ARTA's ownership of ARTARx creates a unique environment where the for-profit pharmacy is allowed to generate revenue income that directly goes back to the ownership. That's the association. So that revenue is then used by the association in the way that the board of directors deems is appropriate. What commonly is seen is that the administration costs of the benefits plan will be offset by the revenue generated through the pharmacy. This creates some stability or um, cost stabilization of the premiums for the association when offering benefit plans. So it's a unique model, and we're happy to see it here. And it actually has been successful. Uh, Recently, in November, we've seen uh, an actual reduction in the overhead charges of the ARTA benefit plan, thanks to the revenue generated through the ARTARx pharmacy. We're also really excited to expand the ARTARx services that are being provided to ARTARx South. Those are our members that are in Calgary and the general Calgary area. So we've recently opened up that pharmacy. And again, it's another opportunity for more of our ARTA membership to utilize their pharmacy and the purchasing power through ARTARx pharmacy to generate income to further create stability in the premiums and the coverage offered by ARTA. I'll give a little bit of an overview next on the Alberta College of Pharmacy. So as mentioned in the slide, this is the regulatory group that oversees the practice of pharmacy in Alberta and serves the interest of the public to ensure pharmacy is practiced in a consistent and safe manner. So every professional group in Alberta, so physicians, nurses, dentists, pharmacists, anybody that's under the scope of the Health Professionals Act, has their own unique college that oversees the standards of care and practice of that professional group. So a common question that we see is, my physician is overseeing my care, and that's totally appropriate and that needs to happen. But a pharmacist and pharmacy teams are also supporting that kind of circle of care for an individual, and every professional is responsible for their scope of practice, and those standards are set out by their respective college. So the next slide we'll get into here is the specific standard of care for standard of practice for virtual care. This was approved by the council in 2023 and has been updated in 2025. This particular piece of legislation outlines how pharmacy professionals are to conduct care or regular restricted activities, pharmacy activities, when the individual or the client is not in person attendance at the pharmacy. So there's lots of this is how the regulatory group is responding to all of the technologies and advances for communicating with our clients. So now we can always support our clients over the phone. There's also secure video conferencing as well that expands the provision of care to our clients, as well as delivery. We're seeing a lot more pharmacies offering delivery services. So these all impact when clients would attend a pharmacy in person physically at the pharmacy location. There is a link to the actual legislation for your reference as well. And as Jennifer mentioned, this session is recorded, so you can refer to that at a later date. I'm gonna step into the importance of in-person care at pharmacy and how the Alberta College of Pharmacy sees the provision of care in Alberta. So ARTA and the Alberta College of Pharmacists both agree that in-person care is the gold standard or the ideal method for providing care to our clients. It's always great to see our clients in person. A lot of things come out through an in-person consultation that support the knowledge of the pharmacist or the pharmacy team in response to that client's care. It's the best way to build that relationship, that professional relationship, and that rapport with our client. The standards of practice for virtual care in Alberta dictate that virtual care can be used in Alberta to complement in-person relationships with our pharmacy clients. It cannot be used exclusively as the only method of interaction to support clients. That is the key piece of information that comes out of the legislation. In Alberta, we can only use virtual care to support a relationship that is in person at the pharmacy. It cannot be used in exclusion alone. And so what that offers or what that means is delivery is a component of virtual care where clients may not be attending the pharmacy in person to pick up that medication or be counseled on that medication. And so the college is reminding ARTARx that we have to maintain a documentation and a plan for having that interaction, that in-person interaction with our clients. So the next question that typically comes up is what is in-person care? So this is our face-to-face interactions with the pharmacy professional at the pharmacy. This can happen through a variety of opportunities where the pharmacy team can document this interaction, make notes, and support the client's knowledge of the pharmaceutical treatments and their health information in general. The best opportunity that we love to promote with our clients is the comprehensive care plans. So these are care plans. Ideally, it's an appointment where the pharmacist or the pharmacy professional may be gathering some information about you, your health states, your medications, either prescription, over-the-counter, supplements, vitamins. What are your specific health goals? What are the outcomes? What are your potential challenges to your health? It's a comprehensive way of kind of assessing you, your health journey, answering any questions or concerns. There's space in our operating system to capture all this information and data. So it is the ideal place and time to kind of have that comprehensive discussion. Now, not all individuals need to do this or feel like they want to participate in a comprehensive care plan, and that's okay as well. But we feel it really supports the pharmacist to get to know our clients and address their questions and concerns. Other opportunities to provide in-person care, prescription pickups and drop-offs. Those are great counseling opportunities, especially when there's maybe a new medication. If we're providing immunization or injection services, those are obviously done in person. And it's a great way for us to get caught up on your regular routine vaccinations, as well as maybe to get to know you and assess what the challenges may be if you're on a trip for travel and you may want some additional medications or vaccinations to support the safety of that traveling. And then there's also, counseling on medications and health information. These are all examples of how pharmacists can support our clients in person. A common question we get is that a physician, again, is supporting my like make appointments with the doctor, and they're supporting my prescription and knowledge base there, and that falls under their professional scope of practice. Pharmacists have a separate and unique scope of practice as well. And so this is what this in-person care would be supporting a pharmacist or pharmacy team professional's scope of practice. Another common question that we're seeing about in-person care is what is the frequency of care that is required for me? And there is no specific wording from the Alberta College of Pharmacy of what regular is. It's best determined between the professional judgment of the pharmacist and the needs of that client. So there are many different factors that might come into play when determining what that minimum or maximum or what that appropriateness of in-person care is. Ideally, we love to see our clients more often than not. The more interactions we have with our clients, the better we're able to support them through their health goals and addressing the needs that they've got as well. So there's no minimum amount and there's no maximum amount, but it's got to be clinically appropriate between the client and the pharmacist. So I'll kind of speak to what are those factors, or what are examples of the consideration a pharmacist may use to determine, is this in-person care enough? So things that we might look at, or the pharmacist may look at, is the stability of your health and accomplishing those health goals. So if you have a lot of challenges that are maybe not being addressed or not meeting those specific goals of your health, there's maybe poor adherence to your medication, maybe a lack of understanding of what that medication does and how it can be used. If there are any drug-related problems, if you're having interactions, if you're having adverse effects, that may need more frequent opportunities to monitor to ensure that we are moving towards some effective treatment of your symptoms and health conditions. Those factors may play into how often we may need to see you in person at the pharmacy so that we can assess that situation. And also the quality of contact that we're having with our clients. Again, just going back to those comprehensive care plans, it's the best, we feel it's the best way to interact with our clients, get a comprehensive assessment of you and your needs, and for the team to document that information on our system to ensure that we're moving towards meeting those goals and addressing those concerns. So those are just some examples of what the team may be using to determine that appropriateness of in-person care, as well as what is meaningful to the client. That's also a big factor in what we'll be doing. So the next question that often comes up, or one of the questions that often comes up, is why is this change in policy happening now? ARTARx has been in Edmonton, has been in operation for some time, and now I've received an email stating that there'll be change to how I receive deliveries. So this policy is changing in response to our collaboration with the Alberta College of Pharmacy. The Alberta College of Pharmacy had introduced this legislation back in 2023, and now they're kind of supporting pharmacies in Alberta with this legislation and how it's practically implemented in the pharmacies. What are those things that the college would like to see in order for pharmacy care to be provided in a consistent basis throughout the province? So all pharmacies are going to be held to the standard. It is not just ARTARx. It is all community pharmacies that will be held to these standards. So again, we're just working with the College of Pharmacy to ensure that we're meeting these standards of care as they're interpreted by the Alberta College of Pharmacy. And then more recently in 2025, we did have a practice care consultant come into ARTARx, do a site visit and assess, how are we implementing these standards of care. They noted that there is a requirement to increase the assessments of the in-person care and the documentation of in-person care on our systems. So they would like us to see this done on a more consistent basis than we had been doing in the past. So this is the change. This is what's led to the change strategy and ARTARx's response to that on-site assessment are kind of noted here. We've updated our policies and procedures of the pharmacy to support the clinical staff in how to complete the assessments and what documentation should look like on our client's file. We've had some communication go through ARTA scripts promoting the opportunity and the importance of in-person care. We've also recently successfully recruited some clinical staff into the ARTARx pharmacy to improve the capacity to provide these assessments and documentations. And again, the communication strategy that we've conducted, email, phone messaging, and these webinars as well to support our clients' knowledge and understanding. So getting into ARTARx's delivery service, just wanted to reiterate that delivery service remains available at ARTARx Pharmacy. ARTA had invested in two delivery vehicles in Edmonton. We hire ARTA members on a part-time basis to support those distributions through the pharmacy. So there has been a significant investment in supporting our clients with delivery service. That is not going away. ARTA is not trying to make any cost-cutting measures, or it's not in response to any requests for cost-cutting measures. We fully recognize that delivery service supports our clients and their access to medications, and we stay committed to that. Essentially, this change is to support that we can have ongoing delivery service while meeting the needs to achieve the standards of care set out by the Alberta College of Pharmacy. So this policy change is done to support that ongoing delivery service. Just a note here, we often see some consultations or considerations of, what happens if we don't meet these standards of care. Essentially, these are non-negotiable. To be an operator or licensed pharmacy in Alberta, we have to meet the standards of practice set out by the Alberta College of Pharmacy. So the team has been quite successful in the last couple of weeks to improve the capabilities of documenting and assessing our clients. So we're happy to continue that and moving forward. And we do appreciate the patience and the understanding and the support of our clients as the team works through this process. We do have an amazing group of talented health professionals in the pharmacy, and they are doing their best to conduct these assessments and collect these documentation notes in the system to support the clients. Their priority is the client care, and they are working through this process to ensure that we continue to support our clients through the ARTARx pharmacy. So the next question that often is seen is kind of determining eligibility for delivery. So what does that look like? What does that mean? There are a few steps and consideration the pharmacy team is using, and these were provided to us by the Alberta College of Pharmacy when they did that on-site assessment. So what the team is doing when they have these assessments or consultations, on top of what was previously mentioned, getting to know you, your health needs, and your goals, they're looking to document when the last in-person care was provided to you. What was the nature of that interaction? Was it a comprehensive care plan? Was it a prescription pickup? Was it a counsel? Was it an immunization service? Like, what was it and when did it happen? If they've noted they have not seen or had any documented in-person care for you in an extended period of time, they will make a plan for when that opportunity for that next in-person assessment would be. So there needs to be a plan or strategy or schedule for when the team can anticipate seeing the client in person, so that they can document that, provide some notes, assessments, and support those clients' needs going forward. If there's is there an urgent need to assess a client? That's another factor that the team will be assessing when they're talking to you. Is there a risk to safety or efficacy that would require that person to come in right away? Or can that be done virtually, as we've previously assessed this person in person at the pharmacy? Other things that the team is considering: is there good adherence to their medication? Is there good understanding of the goals and what the medication does? Are there any drug-related problems that are happening that the clients may need to come in and be assessed for? Is this delivery in the best interest of their clients? Is there details or information about the client's access to medication that they would need to consider. Is there transportation issues? Are there weather considerations? Just really capturing those details or factors that are influencing the client's access to medications. So that's just a bit of what the team will be using to assess the eligibility of delivery. And I may not have made this point earlier, but the team is documenting the overall health of the individual as well as documenting the need for that person's delivery at that requested time. So the next slide here just kind of speaks to what are my options if I'm unable to regularly attend ARTARx pharmacy in person? What if that model or that is not agreeable to me at this time? So in accordance with the Alberta College of Pharmacy Standard of Practice for Virtual Care, delivery or client care may not be appropriate for that individual if we have never had you in the pharmacy and there is no plan to attend the pharmacy in person. The pharmacy is operating outside of this standard of practice, and we would need to make adjustments to ensure that the client's care would be supported under the standards of practice of care in Alberta. So again, this is a difficult question. This is a difficult situation. We're hopeful to have the support of our clients, recognizing this is a change in what was previously done. But again, we want to ensure that the client's care is prioritized, and we want to ensure that the client's care is done in a way that supports our practice under the standards of care and also prioritizes the needs and requirements of our clients. So if you haven't attended in the past, hopefully there's an opportunity to schedule that in the future. If not, ARTA and ARTARx will be working with these clients that where this model doesn't meet the needs or of the client and doesn't meet the needs of the legislation. We'll be working with these individuals to support a transfer or a transition of care to a local pharmacy where the individuals will be able to be supported by in-person care. So that's something the pharmacy team will work through with the client, where that pharmacy would be. And then the support of the member services team, as there may also be need to update or change the benefit plan selection under ARTA to ensure that there's appropriate and effective health benefits coverage. So both the pharmacy team and the member services team will make every effort to support our clients to ensure that they've got appropriate pharmacy and clinical care as well as health benefits coverage. And there's a common question that comes up, can I change my benefit plan if this delivery policy no longer meets my needs? Yes, we do make it a change in benefit plans accessible to our clients, recognizing that it may be a challenge for some people to attend the pharmacy in person. And there are many other benefit plan types that ARTA provides that don't require the use of ARTARx pharmacy and still provide effective, meaningful coverage, health benefits coverage for our clients. So ARTA wants to provide options for our clients, and ARTARx is one of those options for our clients, as well as a variety of benefit plans to support clients. So I'm hopeful I've left enough time to address the questions that have kind of popped up over my discussion. So I'm happy to address those as they come up.
Yeah, there are quite a few questions. One question, will you be charging Alberta Health for Care Plan when we come in twice a year?
So the frequency of the care plans is annual. There are follow-ups as well. So the convention is that if your health meets the standards or the requirements for providing a care plan, So there's two different billing types there. There's the comprehensive care plans. Those would be if there's identifiable two different chronic health conditions and potentially a risk factor as well that's involved. So that's a billable opportunity. And what will be billed is your Alberta Health Insurance Plan for clinical services. So this is the same publicly funded uh, billing that we would bill for your flu shots and previously any publicly funded immunization that service is billable under your Alberta Health Insurance Care Plan. That would be the same model for hospital visits or uh, um, anything that's publicly funded. So it's not under your Alberta Seniors Plan if you're over the age of 65. This is a different publicly funded opportunity for pharmacies to provide clinical care to our clients. So that like is done annually. And there's a simple medication management assessment that's also done if your health state is a little less complicated, maybe just one chronic health condition with other risk factors that are identified by the pharmacy team. Uh, so it would be billed under your Alberta Health Insurance Plan. If your health state is not meeting those standards, essentially this is a way for the pharmacy team to provide clinical care and support. An ARTARx pharmacy would not be charging you any out-of-pocket cost to provide these care plans. So if you are eligible for public coverage, that's a way for the pharmacy team to generate revenue. Um, to recognize the clinical work the pharmacist is doing. But if you don't qualify, the ARTARx pharmacy will not be billing you an out-of-pocket cost for that. But if that conversation is in support of a travel uh, consultation, then there are other billing opportunities that the pharmacy team may do at ARTARx pharmacy. I hope that addresses that question.
There are quite a few questions asking about whether or not you can meet on Zoom, whether you can meet virtually, why you need to be in person.
Yeah, so that goes back to that standards of practice of virtual care. The college has identified anything as virtual care that is not an in-person attendance of the pharmacy. So ARTA RX is enabled with technology, video conferencing technology, through our operating system to do a like this, a Zoom or a Zoom like a video like consultation. Unfortunately, this falls under the provision, or not unfortunately, but it falls under the provision of providing virtual consultation. So we recognize having a video screen is also advantageous and supporting our clients' consultation, and we can support that. But the College of Pharmacy recognizes it as similar as a phone call, where we're not supporting in-person care. So this type of an approach is not seen as in-person care. That is only when consultations or conversations are had in person at the pharmacy.
There's also a question about whether or not other pharmacies, so for example, Shoppers, Rexall, other larger chains, are governed by the same delivery model, or is it just the smaller pharmacies that are being asked to make this change?
It's a great question. The Alberta College of Pharmacy oversees all pharmacy practice. So all pharmacies, big and small, in Alberta will be held to this standard. Some pharmacies are operating outside of Alberta and delivering in to Alberta, and that's an operating model that doesn't fall under the scope of the Alberta College of Pharmacy, where the Alberta College of Pharmacy is responsible to all pharmacies within Alberta.
Okay, another question. How will I know if my in-person visits to the pharmacy are meeting the standard expected? Will a pharmacist notify that the visit frequency is not high enough?
Yeah, so any opportunity to have an in-person assessment or conversation is being documented by the pharmacy team. Where it's a great question. Where the promotion of comprehensive care plans really supports is in practical terms. If you have a concern or consideration for medication, we can document that we've had a consultation or conversation about all of your medications. So if you need your blood pressure medication and you've come in to pick that up in the past, that in-person care counsel, whatever that opportunity was in support of that medication. So if you need delivery of that medication in the future, the pharmacy team can document, we've had a conversation, we've done an assessment, it was done in person about that medication. Let's say there was a new medication for cholesterol management that was added to your regimen, and the team hasn't been able to provide that counsel or that conversation in person, but maybe did it virtually over the phone or on a video platform, and delivery was provided of that medication. The team is going to be challenged with when was the last time we were documented an in-person assessment of that new cholesterol medication. So we may need to book an appointment of that, or like I said, schedule a comprehensive care plan to go through all of your medications to support that the pharmacy has touched on all of your medications with that care plan.
Another question, could our local pharmacy send a report to you instead of having to come in person?
So it's an interesting question. If a local pharmacy is doing a care plan for you, they are taking over that care. It's their fulfillment of providing that care to you. It would not be appropriate for us to provide delivery of that medication when our pharmacy and our pharmacy team has not provided that in-person care of you. So no, that would not meet the standards of care under this provision.
And then questions about an appointment. Do I need to make an appointment to make a care plan to get prescriptions delivered?
It is definitely appreciated to have an appointment. These care plans, we would like to ensure that we've got appropriate resourcing. So a pharmacist that's able to have an in-depth conversation with you. A private counsel space is also commonly required, just so that we can do a comprehensive analysis and assessment of your needs. So an appointment is definitely appreciated, just so that we can ensure we've got the right resourcing available to you.
Okay, another question, how frequently are in-person required if there is a prescription on file for refills?
Again, the frequency is going to depend on those factors that we discussed in the session. When was the last time we saw you? What are your specific health needs? What are those challenges that you are experiencing, if any? Then again, when is that frequency going to be needed? Is a determination between the client. We always take the client's viewpoints into consideration, and the pharmacist for their assessment of, is this person stable? Are they understanding their medication? Are they adherent to their medication? What are the challenges for this individual? Those are all factors the team is going to use to kind of create that frequency need,
There
individual basis.
Okay, there is a comment about whether or not we have pushed back to the ACP about having to do in-person care.
Yeah, there has definitely been a lot of discussion with the Alberta College of Pharmacy when this legislation was introduced. Pharmacy ARTARx and our banner group Whole Health did submit feedback to the college about this legislation, and we did express our concerns and priorities to support our clients where mobility may be an issue, aging at home is a priority, and just ensuring that, again, our clients' care was optimal and optimized, and recognizing that there's technology out there that can be supportive of interactions with our members that provides uh, increased access and frequency as well. So we have had several consultations with the Alberta College of Pharmacy over this.
Okay. There is a question about having to come in and get one of your regular medications right away without coming in for an in-person care. Are they able to get that prescription elsewhere?
Yes, if there's urgently needed access to medication, we will work with the individual to ensure that they get the care and access to their medication. There may be, depending on the type of plan the individual has purchased through ARTARx, that may result in an out-of-pocket cost after coverage. If that is the a issue in that instance, we can submit for a review of that situation to potentially look at covering that out-of-pocket costs. But if that is going to be the regular standard where the client will continue to use a local community pharmacy, that specific plan may not be the best option. That might not be the most effective coverage for that individual. So there may be need to work with the member services team to look at what are the other plans out there that would provide a more cost-efficient, effective health benefits coverage.
And there is a question about whether or not we will be reaching out to our clients if they need to come in for an in-person care or if they need to reach out to us.
Great question. If you're regularly attending the pharmacy and then requesting a delivery of your medications, the team will be looking at your profile on our operating system to see when that last regular in-person assessment was done and what was seen. If there is a need to have you in person, the team will have that discussion with you. Um, we don't want to fall into a situation where we won't provide you with medication if you haven't been seen in person. Essentially, the team would create a plan or schedule an opportunity for that when that next in-person appointment or opportunity could be had. So again, we want to ensure we are prioritizing our clients have access to medication, but we also have to create a plan of action for meeting these standards of care and documenting that in-person assessment. So I'm hopeful that's clear in that we're not going to hold medication and not deliver it to our clients, but we have to have a firm opportunity to meet those in-person requirements as well. So that'll be a part of that delivery discussion.
Okay, another question. If I have an intermittent but do not use medication chronically, do I need an annual in-person assessment?
You may not qualify for a care plan because your health needs don't meet those publicly funded care plan assessment, but we would need to have some sort of in-person documentation of us having supported you in person for that medication. So if you come in for immunization and we can, layer in a discussion about that intermittent medication, then that's an ideal opportunity. If there's an opportunity for you to come in and pick up that intermittent medication when you're in the neighborhood, or I know if you've got a specific question about that medication and you can do that in person, then we can document and assess that opportunity at the pharmacy. But yes, we do have to have some sort of in-person documentation in order to support delivery of your medications.
Another question, can I have my prescriptions with ARTARx transferred to a neighborhood pharmacy?
You can just request that of the team. There may be some coverage implications there, and you'll want to speak with a member services team member to ensure that you've got effective benefits coverage if you're moving away from ARTARx pharmacy.
Right. I know that there's a lot of comments in the Q&A. We will get to those comments right away, but I'm just trying to see if there's any additional questions that are coming in.
Yeah, just looking at some of these questions that are out there, I understand, this model may be counter to what was initially what we were looking forward to at ARTARx Pharmacy. And I appreciate that concern, and that hence recognizing that these plans or this relationship may not be conducive to, your needs now. So there's freedom and opportunity to look at other coverage models with ARTA that support a local pharmacy, recognizing that this may not work for you anymore. Um, as mentioned in the session, this legislation or these standards are dictated to the pharmacy, and we must be in compliance of them, and we're working into a model to be in compliance with them. So there's only so much ARTA and ARTARx can do. This model of care is something that we feel is important at ArtarX Pharmacy, and we want to ensure that we're supporting our clients with access to their medications by delivery. We want to ensure that we're meeting the standards of care as well that are outlined to us in Alberta.
Okay, sorry, there was a question. Are you accessing our Netcare records for a care plan assessment?
We are. Alberta Netcare is accessible to all pharmacies in Alberta. So that includes ARTARx. And so the clinical team is using that access to Netcare to support the documentation of your health at ARTARx. So yes.
There is a question slash comment about waiting to get an initial consultation. Will the deliveries that are scheduled, will we be delivering in the interim?
Yeah, exactly. So we will be delivering in the interim to those individuals. We will note that we've got a scheduled appointment on your file to have that discussion. We don't want there to be a massive rush of everybody coming in the next month because we do have limited capacity to support these consultations. So we recognize that this will be an opportunity for us to grow into. And so we will be able to support delivery service in anticipation of that care plan. So the pharmacy team will capture and schedule that care plan, and we will have that noted on your file. Delivery will continue to be accessible to you so long as it's clinically appropriate and meets the client's needs.
Um, does a medication review in person with a pharmacist qualify for future deliveries?
It does, yes.
So just see if there's more questions that we can answer live. Is it possible to set up some off-site in-person care locations in the future?
We are looking at what are our opportunities to support our clients that may not be physically located next to us or close to us. Under the standards of care, standards of practice, we have to be conducting assessments within the pharmacy. So we're looking at support of how that specifically would impact doing consultations potentially at home or in a site that is outside of the pharmacy. So we're working with the ACP to get a better understanding of what are those opportunities. Once we have that information, we will be communicating those opportunities if they are agreeable to our membership.
Will there be any evening hours for consultation and pickup of prescriptions?
We will be revisiting the operating hours of the pharmacy in support of these changes.
Will the care plan possibly have conditions that the client must meet to qualify for ongoing delivery?
That would be an individual case-by-case determination. If there are some specific issues that the pharmacist or pharmacy team is identifying, that would need to dictate in-person care that would be captured within that assessment. But it's hard for to comment on that one specifically. So there is a question or a theme that's kind of come up is regarding the cost of coverage for transitioning it away from the ARTARx plan. So I do want to address that in that every plan has its premiums set based on the experience of that health benefits plan. With the model of ARTA-RX generating revenue for the ARTA Association, there is the opportunity to use that purchasing power to stabilize plan premiums. Whereas other plans that don't have a specific provider that's required, that purchasing through the pharmacy is seen as a pure expense to the ARTA benefits plan. As such, the premiums are set based on that format or that plan experience. So I'm hopeful that supports why some plans are more expensive and some plans are less expensive. It's again dependent on the experience that those plans provide to the association to pay out um, versus what potentially the revenue generated through that purchasing through the pharmacy can offset. There's another question here about professional judgment and if there's a discrepancy between the client and the pharmacist. So that's an individual basis that would get into, potentially looking at why is there a disparate, and why is there a disagreement, I guess, on what that potential frequency would need would be. We would have to get into what the specific issue is for that issue for that disagreement. And again, like I said, the appropriateness of in-person care is going to be a dialogue between the client and the pharmacist. If the pharmacist's professional judgment feels that this particular person's need is not effectively managed or supported by providing ongoing delivery, and there needs to be something else, more in-person assessment, we would look on that on a case-by-case basis and determine what the best course of action is for that individual.
There is a question, does the assessment follow a formal format of questions?
There is a format to the assessment for sure. The pharmacy team, we want to be consistent with how these assessments are done. So there is a format that the pharmacist will go through, but dependent on the particular individual and that individual's health needs, There may be some additional questions or things that the pharmacist may want an assessment of, but there's definitely a consistent format for what the pharmacists are looking for.
They're asking, could that be provided?
Uh, yeah, I imagine it could be.
And if there's any updates that we have, just watch for your ARTA scripts newsletter, and we'll make sure all of our members are always informed with any updates that happen, and any more information that we can provide. We'll be sure to put that into our newsletter. There is a question about our online appointment calendar. It is only open until May. We will be opening that up. There's a question, if I'm currently not using any prescription medicines, do I still need the initial consultation?
If you're currently not receiving any prescription medications, do you need to have a consultation? Um, I guess if you are needing delivery of medication, that's going to be the trigger for that in-person assessment. So for a client that may be using the pharmacy for supplements and vitamins, there's different regulations that come with over-the-counter products and provision of them. Um, that's a different scope, and there's a different standards of care for that. If So if you're not using any prescription medications, we could still provide delivery of those over-the-counters and supplements if that's what's being provided by the pharmacy. Um, Maybe I'm not understanding the question, but if that's the situation, then that can be provided without assessment.
How long does an assessment take?
Again, it depends on the individual and their health needs. If there's a lot of things that the team would like to assess and have an understanding of, it may take longer. Generally speaking, for a care plan, we book for a half hour to an hour appointment, just so we can address all those concerns and questions. That's not to say that entire time would be allotted to having that assessment, but it also provides the pharmacist the opportunity to document the information on file as well. If somebody is on a very simple regimen of medications, that assessment might not take very long, especially if it's clear that they've got a firm understanding of the assessment and of their medications as well. So hard to say, but generally speaking, we try to book for a half hour to an hour. So
Is a consult needed for delivery of products that don't require a prescription? For example, glucose sensors.
yeah, exactly. I mean, for glucose sensors, you would be using them generally speaking for diabetes management or pre-diabetes. So the pharmacy team would probably want to get an assessment of that individual's health and what potentially they're using that medication for. Do they need a 30-minute assessment for that? Probably not. But we would like to see them in person so that we can support delivery of those supplies going forward. And again, there's a comment about 30 to 60 minutes for an assessment. This is a time frame. This is how much time we book for the appointments. And with a physician's consultation, there is also time for the physician to document. And so that's what's baked into that 30 to 60-minute assessment, is for the pharmacist to document that interaction as well. So that's not to say that that appointment would take that long.
There's a question on how to access ARTA's YouTube channel. If you just visit YouTube and search the ARTA channel, we'll make sure that this video is uploaded in the next 24 hours.
So there's just a follow-up question on the clarification about prescription medications. Do I still, if they're not using any prescription medications, they don't need an assessment if we're not providing any delivery of medications. So if you're not using the pharmacy at all, there's no need to come in person. But if you do need support with something going forward, a new medication or whatnot, then we would need to have uh, an in-person consultation.
There is another question. Where did doctors send new prescriptions to?
New prescriptions can continue to be sent to ARTARx via fax or electronic e-prescribing. Again, the team will do an assessment of that prescription. If you're wanting delivery, if you're wanting to pick that up, we can also ensure that it's ready for pickup, and we would document that in-person pickup as well. And if there are any counsel opportunities, we can provide counsel of that. There's a question here about booking online appointments. If you have access to Pharma Connect, that's the app that is used to build a profile at the pharmacy. You can book an appointment there, or you can also call the pharmacy to book an appointment. There's a question here about 80% coverage, regardless of which pharmacy they go to. That will, if that is probably one of the ARTA benefit plans that does not stipulate a specific provider. And if that's the case, you get 80% coverage of your medication, regardless of which pharmacy provider you go to. If you want to continue to use ARTARx Pharmacy, we do appreciate it, but we just have to ensure that we've got that in-person care documented. But if you want to use a local pharmacy, there may not be any change to your coverage. That would depend on the type of ARTA coverage that you currently have.
If I'm picking up in person, do I need to book a time so that I get a consultation?
No, you don't need to book a time if you're doing a simple pickup. If you want a more comprehensive care plan assessment, then that we encourage appointments to ensure that we've got available resourcing, and but if you're just doing a simple pickup and you need a counsel on that, just give us a few minutes to get that to you. There's no appointment that's needed for that. So there's a question here that we will no longer be providing free delivery unless we pass an in-person assessment. So just to reiterate, pharma's delivery services continue to remain available to our clients. The pharmacy team is challenged now with assessing and documenting when we provide those deliveries, have we provided that individual with in-person care? If we have not, the pharmacy team will discuss the next available opportunity to provide that care, that in-person care with you. If that's going to be a care plan, an immunization, a prescription pickup, whatever that needs to be, that we'll get that documented. If you need urgent access to that medication, we will be able to get it to you, but we also have to create a plan for when we can assess you in person for that medication. Delivery will remain no charge to our clients. There's no change there.
There is a question about PharmaConnect. It is PHARMA and I'll put that link in the chat.
There's a question here about compounding at the pharmacy. I can just answer that live. We do have a compounding agreement with a compounding pharmacy. So if there's compounded medication that's needed, we work with them. to prepare that compounded medication and have it delivered to our pharmacy. And then we would have it available to you for delivery or for pickup, depending on what your case is needed. And again, if we've had an in-person assessment for you.
We also have a list of FAQs, which I will post in the chat. So you can visit artarx.net. And all there we have created quite a few FAQs that might answer some more of your questions. So I'll make sure I'll put that link up. I think there's one more question there. When I book a consultation, in-person care, can I choose who to talk to, or is it simply the next pharmacist that is available?
Yeah, if you have a relationship with one of our team members, just ask for that individual that you'd like to have that consultation with, and we'll do our best to ensure that we've got that individual there with you. So if you have a relationship with a pharmacist that you prefer to have a consultation with, just ask that of the team. They're happy to support that request.
I don't see any other questions coming in right now. But again, our website, artarx.net, has some really great information on the website, as well as that FAQ link that I posted. And you can always visit our website to email or phone our pharmacy or our member services team if you have any questions about our benefit plans and what is covered. There's someone has their hand raised. Your video and microphone are disabled to ensure your privacy. So if you don't mind typing your question into the Q&A, we can get to that right away. Okay, I don't see any other questions coming in. Thank you very much, Yatin, for answering all of our members' questions. And I hope everyone has a lovely day.
Thank you so much.